Imagine this. You're sitting at home, feeling the familiar ache of a headache, or the discomfort of acid reflux. You reach for that bottle of ibuprofen or omeprazole without a second thought, trusting these medications to make you feel better. But what if I told you that some of the most common drugs we rely on every day could be silently increasing your risk of a heart attack? Shocking, isn't it? Each year, over 800,000 people in the US alone suffer heart attacks, and emerging research suggests that certain medications, some of which may already be in your medicine cabinet, are contributing to this alarming statistic. As a veteran doctor with decades of experience in cardiovascular health, I've seen firsthand how seemingly harmless pills can have devastating consequences when used improperly or without awareness of their risks. In this video, we'll uncover 8 medications backed by scientific research that could be harming your heart. From everyday painkillers to treatments for chronic conditions like diabetes and acid reflux, these drugs are more dangerous than you might think. But don't worry, we'll also explore safer alternatives and actionable steps you can take to protect your heart while managing your health. By the end of this video, you'll not only understand the hidden dangers of these medications, but also gain the knowledge to make informed decisions about your well-being. So, buckle up. Your heart's health depends on it. Painkillers, the silent strain on your heart. Let's start with something many of us use regularly. Over-the-counter painkillers like ibuprofen, Advil, Motrin, and naproxen, Aleve. These nonsteroidal anti-inflammatory drugs, NSAIDs, are go-to solutions for headaches, muscle pain, and inflammation. However, research has uncovered a troubling link between NSAID use and an increased risk of heart attacks. A 2017 study published in the British Medical Journal revealed that taking NSAIDs for as little as 1 week can raise your risk of a heart attack by 20 to 50%, depending on the dosage. The mechanism behind this danger lies in how NSAIDs affect prostaglandins, hormone-like substances that regulate blood vessel function. By inhibiting prostaglandins, NSAIDs can cause fluid retention, increase blood pressure, and constrict arteries, forcing the heart to work harder. Over time, this strain can lead to blood clots, which are a leading cause of heart attacks and strokes. Individuals with pre-existing heart conditions, high blood pressure, or a history of heart disease are particularly vulnerable. But here's the silver lining. There are safer alternatives. Acetaminophen, Tylenol, is a viable option for short-term pain relief, though it should still be used cautiously. For chronic pain, consider natural remedies like turmeric, ginger, or physical therapy. Always consult your doctor before starting any new treatment, especially if you have underlying health conditions. Remember, pain relief doesn't have to come at the cost of your heart health. Antidepressants, balancing mood and cardiovascular risk. Next on our list are antidepressants, specifically selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs. These medications, including fluoxetine, Prozac, sertraline, Zoloft, and venlafaxine, Effexor, are widely prescribed for depression and anxiety. While they play a crucial role in improving mental health, research suggests they may pose risks to cardiovascular health, particularly in individuals with pre-existing heart conditions. A 2018 study published in JAMA Psychiatry found that SSRIs could increase the risk of abnormal heart rhythms, blood clot formation, and elevated blood pressure. Additionally, these drugs can reduce platelet aggregation, meaning your blood doesn't clot as effectively. While this might sound beneficial for preventing clots, it can also raise the risk of bleeding-related complications, such as hemorrhagic strokes. Older adults and those with hypertension or a history of stroke are especially at risk. That said, the benefits of antidepressants often outweigh the risks, particularly for those struggling with severe depression. If you're concerned about your heart health, discuss alternative treatments with your doctor. Cognitive behavioral therapy, CBT, lifestyle changes, and regular exercise can naturally boost serotonin levels and improve mood without the potential side effects of medication. Never stop antidepressants abruptly. Always taper off under medical supervision to avoid withdrawal symptoms. Bariger's calcium channel. Blockers, a double-edged sword. Calcium channel blockers, CCBs, like amlodipine, Norvasc, and diltiazem, cardizem, are commonly prescribed to treat high blood pressure and chest pain, angina. These medications work by relaxing blood vessels and reducing the heart's workload, effectively lowering blood pressure. However, certain CCBs, particularly short-acting formulations, have been linked to an increased risk of heart attacks and heart failure. A study published in Circulation found that some CCBs were associated with a 25% higher risk of heart attacks in certain patients. These drugs can cause fluid retention, worsening heart failure, and lead to low blood pressure, dizziness, or fainting. Additionally, they may interfere with heart rhythms, increasing the risk of arrhythmias in susceptible individuals. If you're taking a calcium channel blocker, monitor for side effects like swelling, dizziness, or irregular heartbeats. Discuss with your doctor whether alternative blood pressure medications, such as ACE inhibitors or beta blockers, might be safer for you. Regular checkups and open communication with your healthcare provider are essential to ensure your treatment plan is both effective and safe. Your SEER, diabetes medications. Navigating cardiovascular risks. Diabetes management is a delicate balancing act, and certain medications can complicate matters further. Older drugs in the thiazolidinedione (TZD) class, such as rosiglitazone, Avandia, have been linked to a significantly increased risk of heart attacks and cardiovascular death. A landmark 2007 study in the New England Journal of Medicine found that rosiglitazone was associated with a 43% higher risk of heart attacks and a 64% increased risk of cardiovascular mortality. The problem lies in how TZDs affect the heart. These drugs can cause fluid retention, leading to swelling, elevated blood pressure, and additional strain on the heart. Over time, this can worsen heart failure or trigger cardiac events in high-risk individuals. If you're taking rosiglitazone or other high-risk diabetes medications, talk to your doctor about safer alternatives like metformin, SGLT2 inhibitors, or GLP-1 receptor agonists. Lifestyle changes are equally important. A balanced diet rich in whole grains, lean proteins, and healthy fats, combined with regular exercise, can help manage blood sugar levels while reducing cardiovascular risks. Remember, diabetes care is not just about controlling glucose, it's about protecting your heart and overall well-being. RACEs, decongestants, the hidden danger in cold medications. Decongestants like pseudoephedrine, Sudafed, and phenylephrine are staples in many households during cold and flu season. These medications relieve nasal congestion by constricting blood vessels in the nasal passages, making it easier to breathe. However, this same mechanism can pose serious risks to heart health. Studies show that pseudoephedrine can significantly raise blood pressure and heart rate, placing extra strain on the cardiovascular system. This is particularly concerning for individuals with hypertension, heart disease, or a history of stroke. Decongestants can also trigger irregular heart rhythms, arrhythmias, and may lead to chest pain or palpitations in sensitive individuals. If you have high blood pressure or heart disease, avoid decongestants altogether. Opt for natural remedies like steam inhalation, saline nasal sprays, or antihistamines if allergies are a factor. Always read labels carefully and consult your doctor before using over-the-counter medications. Your heart will thank you for choosing safer alternatives. Chemotherapy drugs. A necessary evil. Chemotherapy is a lifeline for cancer patients, but some drugs come with serious side effects on the heart. Anthracyclines like doxorubicin, adriamycin, and fluorouracil, 5-FU, are known to cause cardiotoxicity, weakening the heart muscle and increasing the risk of heart attacks. A study published in JACC:*Cardio-Oncology found that doxorubicin could lead to heart failure in up to 26% of patients, especially at high doses or with prolonged use. These drugs damage heart cells by generating free radicals, causing inflammation and scarring in the heart tissue. Fluorouracil has also been associated with coronary artery spasms, restricting blood flow and triggering heart attacks. If you're undergoing chemotherapy, your doctor may perform regular heart function tests, such as echocardiograms, to monitor for damage. Medications like dexrazoxane can help protect the heart. and maintaining a healthy lifestyle, staying active, eating well, and avoiding smoking can further reduce risks. While chemotherapy is often necessary, understanding its potential impact on your heart empowers you to take proactive steps to safeguard your health. Testosterone and anabolic steroids. Strength at what cost? Testosterone therapy and anabolic steroids are often used to boost muscle growth, enhance athletic performance, or treat low testosterone levels. However, these substances come with significant risks to heart health. A 2017 study in JAMA Internal Medicine found that men who started testosterone therapy had a 30% increased risk of heart attacks and strokes within the first 3 months of use. Testosterone and anabolic steroids can raise red blood cell counts, thickening the blood and increasing the risk of blood clots, high blood pressure, and heart attacks. They also lower HDL, good cholesterol, and increase LDL, bad cholesterol, contributing to artery blockages. Long-term steroid use has been linked to left ventricular hypertrophy, a condition where the heart's walls thicken, making it harder for the heart to pump blood efficiently. If you're considering testosterone therapy, ensure it's prescribed and monitored by a doctor. Avoid anabolic steroids altogether and focus on natural ways to boost testosterone, such as strength training, consuming healthy fats, and prioritizing sleep. Your heart is worth more than any temporary gains. Proton pump inhibitors. The hidden link to heart attacks. Finally, let's discuss proton pump inhibitors, PPIs like omeprazole, Prilosec, and esomeprazole, Nexium, commonly used to treat acid reflux, GERD, and ulcers. While effective, long-term use of PPIs has been linked to an increased risk of heart attacks. A Stanford University study analyzed medical records of over 3 million people and found that PPI users had a 16 to 21% higher risk of heart attacks, even in those without prior heart disease. The suspected reason is that PPIs may reduce nitric oxide production, which is essential for keeping blood vessels flexible and open. Over time, this can lead to stiffer arteries, higher blood pressure, and an increased risk of blood clots. PPIs have also been associated with magnesium deficiencies, which can cause irregular heart rhythms and muscle weakness. Use PPIs only as needed and explore safer alternatives like H2 blockers, dietary changes, and natural remedies such as ginger, aloe vera, and probiotics. If you require long-term acid reflux treatment, consult your doctor about heart-friendly options. Your digestive health shouldn't come at the expense of your cardiovascular well-being. Key takeaways, says 1. Be aware of risks. Common medications like NSAIDs, antidepressants, and PPIs can increase heart attack risks. 2. Explore alternatives. Safer options exist, from natural remedies to lifestyle changes. 3. Communicate with your doctor. Regular checkups and open dialogue are crucial for managing risks. 4th, prioritize heart health. Balance the benefits of medications with their potential cardiovascular impacts. Your health is in your hands. By staying informed and making mindful choices, you can protect your heart while managing other health concerns. If you found this video helpful, give it a thumbs up, share it with others, and subscribe for more science-backed health tips. Stay informed, stay healthy, and take care.